Welcome to Med Insight. My name is Dr. Adejate. In this video,
We'll talk about the platelet component of a full blood count. Let's go. Platelets are produced in the bone marrow from large cells called megakaryocytes. They are crucial for blood clotting and hemostasis, that is, the process of stopping bleeding at the site of injured blood vessel, preventing hemorrhage. When a blood vessel is damaged, platelets are the first responders. They adhere, activate, and aggregate to form a temporary platelet plug at the site of injury, securing hemostasis. A standard complete blood count report includes several key parameters related to platelets. The first on the list is platelet count. This is the absolute number of platelets per microliter of blood. Thrombocytosis, that is high platelet count, can be divided into reactive and essential thrombocytosis. Reactive thrombocytosis is more common. There is an increase in the number of thrombocytes in response to an underlying condition like infection, inflammation, iron deficiency, post-surgery, or cancer. Platelet function is usually normal. On the other hand, essential thrombocytosis is less common. It is caused by bone marrow disorder. Example is essential thrombocythemia, a type of myeloproliferative neoplasm. This carries a higher risk of both clotting and bleeding due to dysfunctional platelets. Thrombocytosis increases the risk of blood clots, which can lead to stroke or myocardial infarction. Thrombocytopenia, that is a low platelet count, it can be caused by increased distraction from autoimmune diseases like immune thrombocytopenic purpura, decreased production from bone marrow failure like leukemia, sequestration from enlarged spleen, dilution from massive blood transfusion, liver disease, side effects of certain medications like chemotherapy. With thrombocytopenia, the risk of bruising and bleeding increases significantly as the count drops below 50,000. Spontaneous bleeding can occur below 10,000. The next on the list is mean platelet volume. This measures the average size of the platelets in a sample. MPV is an indicator of platelet production and turnover. A high mean platelet volume indicates larger and younger platelets that have been recently released from the bone marrow. This is seen when platelet production is increased in conditions like immune thrombocytopenic purpura, during platelet recovery after an episode of thrombocytopenia, or in recovery from chemotherapy. Low mean platelet volume indicates smaller and older platelets. This suggests low platelet production. It is seen in conditions like aplastic and megaloblastic anemia, bone marrow suppression, and chronic inflammatory diseases. The next on the list is platelet distribution width, PDW. This is a measure of the variation in platelet size. It tells us how uniform the platelets are. A high PDW is often seen in conditions with high platelet turnover, like immune thrombocytopenic purpura. A normal PDW suggests a more homogeneous population. It is often interpreted alongside the MPV. It suggests platelet activation seen in conditions like inflammatory diseases and cardiovascular disorders. A low PDW may be linked to bone marrow disorders. Plateletocrit, or PCT. This is the volume of blood occupied by platelets as a percentage. It is not routinely used in isolation, but can provide an overall picture of the total platelet mass. It is generally low in thrombocytopenia and high in thrombocytosis. The last on the list is platelet large cell ratio, that is PLCR. This shows the percentage of large and young platelets in the blood. It indicates the bone marrow activity and platelet production. It is interpreted alongside the platelet count, mean platelet volume, and platelet distribution width. A high PLCR may suggest increased production of platelets by the bone marrow. It is seen in autoimmune disorders, inflammatory conditions, infections, and certain cancers. A high PLCR may increase the risk of clotting, stroke, and myocardial infarction. A low PLCR may suggest decreased production of platelets by the bone marrow. It can indicate bone marrow diseases due to low production or older platelets being dominant. These differentials transform a simple platelet count from a mere number into a dynamic story about what is happening in the bone marrow and the periphery, greatly aiding physicians in diagnosing the cause of bleeding or clotting disorders. Thank you.
Don't forget to subscribe, follow, share, and like our platforms.